Okay, so we are going to do a follow-up video with more exercises from that presentation we did a few weeks back for core and the pelvic floor. I talked a bit too much at the beginning and the middle, which didn't leave a ton of time to actually kind of go through and practice some of the exercises. So I wanted to make sure that we gave you guys something tangible that you guys can start practicing at home. So for those of those that didn't watch the initial one, I will do a brief kind of review of some of those things that we talked about. So there's some basis behind some of the exercises. For those that did attend that want to skip all that, just go ahead and fast forward until you start getting to the videos. I will say that the videos on here didn't end up like, you can't hear them very well with this recording. So I ended up just kind of talking over and saying the same things that the videos are saying. So if it doesn't work, just please reach out and I can like send you the videos personally if you really need to. I am not super good with technology. So yeah, just let me know if you need anything. So with the outline, what we're going to do is start by just reviewing, like I said, that pressure canister concept, and then going through a bit of anatomy. So we're going to go through first with the breathing, the pelvic floor, and the TA, which are kind of our basics. And then we're going to go into more functional type movements. And then at the end, we will discuss a little bit about modifications. So a lot of when they think about the core, they think about our core as just kind of our abdominal muscles. And that is not incorrect, but I want us to go a step further and think about our deep core as this three-dimensional system. So it has a top, a bottom, and then the sides. And when you think about pressure within that pop can, when there's too much, what happens? It, pops and explodes, which is a little dramatic for the human body, and it just gets bigger. So again, a little dramatic for the human body, but when you're experiencing symptoms such as leaking, heaviness in the pelvic floor region, pain, bulging in your abdomen, among some other symptoms, it can mean that that deep core isn't functioning as well as it could, and we aren't managing those pressures within our intra-abdominal system as well as we could. So here is kind of the different muscles that make up that deep core. So at the top, we have this diaphragm. I want you to appreciate that it goes from your sternum around to the front of your ribs, the sides of your ribs, the back of your ribs, which the back of your ribs attached to your spine. So it is this kind of umbrella type thing. Now, when you take a breath in, the diaphragm flattens, which seems counterintuitive, but it flattens to allow the lungs to fill with air. If we hold our breath, then we can increase pressure within this intra-abdominal cavity and then increase pressure down on the pelvic floor or out on the front of the abdominal wall. So if you've got a diastasis recti, it could exacerbate that too if you're holding your breath. Then we have this transverse abdominis, which is the deepest of the four layers of our abdominal muscles. It goes from your sternum down to your pubic bone, wraps around and attaches to some fascia on the back, acting like that corset or those sides of that pop can. On the back here, we have the multifidi, which are just some back muscles that help with stability of the spine. And then we've got our pelvic floor here. That is kind of this bowl here. So we are going to start with the basics with getting these. So we're going to look more at the diaphragm, transversus abdominis, or TA, you'll hear me say, and then the pelvic floor. So we want to start laying the foundation to build upon. It does not mean that you have to be a master at any of these exercises with these three body parts, but it's a good place to go back to and practice. The end goal is to be able to take these basics and apply them to everyday movements and exercise. We have to practice the basics just as we have to practice utilizing them with our movements. Just as like an athlete lifts in the weight room and also practices their skills on the field, they need both to kind of be the best athlete they can be. So we'll go through the basics first and then we'll put everything together. This is to be used just as a guideline. Not everyone needs all of these things, or everyone's going to need something a little bit different. If you're unsure if you should be doing these, please reach out to your healthcare provider or ask us questions. We are happy to answer them. Okay, so let's start with the diaphragm. So again, like I said, it's kind of like that umbrella. When you inhale, it flattens. And then when you exhale, it comes back up to this dome shape. It works with the pelvic floor. So when you inhale and it flattens, the pelvic floor is also going to relax. And then when you exhale and it comes back up to this dome shape, sorry, let me go back. When it comes back up to this dome shape, your pelvic floor is going to come back up. Now, if you do more forceful expiration, you can actually get more activation with that pelvic floor in your lower TA muscles. So there's other benefits that we won't go over today, but breathing, working in diaphragmatic breathing is good for multiple reasons. So let's get into this. Before I start the video, I recorded this once and then it didn't work because you couldn't really hear the video. So I'm just going to talk over it. I also realized the lighting is like the opposite of ideal. So you can see it well enough, I think, but again, reach out if you have questions. So again, we're going to go for that 360-degree breath. And so I'm going to be finding my rib cage angle. So I'm pointing at my rib cage angle there. And then I am going to take a deep breath in that 360-degree umbrella breath. So I'm going to think the sides, the back, and the front are expanding. You can see it kind of expand through that whole abdominal area. So this is a way to do it wrong. You see how my rib cage went up, my belly button went in, my chest went way up, my shoulders went way up. And then some people will do belly breathing, which is just this. And you can see my rib cage didn't really move. It was only my belly. So we really want to get that 360-degree. You're going to get that entire area there. You can see my whole rib cage kind of expand. And there we're making sure we don't have back tightness and all of that on top of it. And then, whoops. So go ahead and you can pause this video and just practice some of that breathing. Replay it if you need, but really focus on getting that full 360-degree umbrella breath. Watch what your shoulders do, watch what your jaw wants to do, watch what the rest of your body wants to do. This can take a while, so just be patient with it. It can feel very odd at first, but just keep pushing, and it can take a few weeks to start getting. And my natural breathing pattern that I always want to go to is, and I have naturally some shoulder tightness, so I want to breathe up and in, and there I'm like, okay, I need to remember to do some of these diaphragmatic breathing so I can decrease that tension in my upper traps. Okay, so we're going to move on to the pelvic floor. So the pelvic floor is actually 3 layers of muscle. And so you can see on this left side picture here, all this red kind of striated, that's all muscle. So we've got muscles around the urethra, the vagina, and then the anus. So there's many different functions, but a lot of them are to kind of like close the holes when we don't want to pure poop, or pass gas when we don't want to. They help stabilize the pelvis, and then they help support the organs. So if we look over on this other side, you'll see this hammock down here that goes from your tailbone to your pubic bone. There's that TA we'll talk about here in a second. And then this is your bladder, uterus, and rectum. And then under here, you can see a sling of muscle. So again, the muscles will kind of close down around those openings to close them. And then they also provide support for those organs. So let's talk about the Kegel, or the pelvic floor contraction. They're the same thing. There's no video to this for probably obvious reasons, but there are different kind of metaphors we can go through this. So if we start thinking about it as an elevator, I want you to think right now you're at the ground floor. So you're not even really thinking about your pelvic floor. Your pelvic floor may have a little bit of tone to it, just like our spine muscles have to have a little bit of tone when we're sitting, so that we don't just crumple over. Our pelvic floor has to have that same level, or like baseline level of tone when we're up and moving. If we were to contract our pelvic floor and squeeze around the holes, it's like closing the elevator doors. And then if we were to try to go a step further to get our like 3rd layer of our pelvic floor, we're going to squeeze and lift. So we're going to go up to that 2nd or 3rd floor of that elevator. And then now I want you to relax down to that, just like baseline. And then see if you can relax even a little bit further to go down to the basement. You're not like bearing down at this point, you're just relaxing. You're thinking like your sit bones are getting a little bit further apart. your pubic bone, your tailbone's getting a little bit further apart. And then if you were to bear down, like you're gonna have a bowel movement, then you would like push at the basement windows. So it is that full range of motion with the relaxation all the way to the contraction. And it's important to get that, because if you were to imagine holding your bicep on all day, like at a low level, just holding something all day, it'd be really hard to lift something effectively at the very end of the day. So these muscles can fatigue, and some people, instead of needing a Kegel to do to help with their incontinence, they actually need to do the opposite and relax. So not everyone needs to do Kegels. And it could be a reason why you've been doing Kegels and, you know, things just aren't getting any better. So in that case, I would reach out to a pelvic floor physical therapist or your OBGYN and talk more about that with them. And then a blueberry is another one, and I'm sorry, I'm going to ruin that for you. I mentioned this one on our first video too, and you're going to think squeezing the blueberry and lifting it up your vagina, or a smoothie, like sipping a smoothie up with your vagina. And again, just trying to get that squeeze and the lift. To get that TA that we'll talk here in a second, that deepest core layer, you can think of like a zipper from your vagina to your belly button. So your lowest TA fibers, the muscle fibers that are kind of below your belly button down to that pubic bone, do work with your pelvic floor. So when you think about starting from your vagina and kind of zipping up, you may feel like that lower abdominal area contracts just a bit. And by contraction, it should mean kind of like it gets a little bit flatter. Now, when you do these, we have fast twitch and slow twitch muscles. So you can work quicker. You can do 5 to 10 reps of trying to get through that full range of motion. Make sure you relax fully in between each one. Or you can do more holds. So you can try to hold for like 5 to 10 reps of 5 to 10 second holds. They're both important if you need to cough, sneeze, laugh, whatever. Those quicker fibers, the fast twitch fibers are better for that. And then the more slow twitch fibers do more of kind of the endurance holds. So again, you can pause here and try doing some of those and see what you feel. Also notice, what are your glutes doing? Your inner thigh muscles doing? Are your abs clenching down? Are you holding your breath? So this is a ton to think about. So just pick different things and start noticing it. And again, it can take several weeks for you to start feeling like super coordinated. Now, if that wasn't enough to think about, we're going to try pairing them both together. So I said before that the breath and the pelvic floor work together. So I want everyone to try inhaling, thinking you're expanding at that 360 degrees. So inhale. At that same time, your pelvic floor is relaxing. And then on your exhale, maybe try activating that pelvic floor just a bit. This is more helpful to do if you get like a pursed lips exhale. If you're just super confused and this seems like too much, just think about exhaling on exertion with activity. So if you're doing a squat, the general guideline for that is you inhale on the way down and exhale on the way up, or exhale on the hardest part of the movement. So sometimes that is on the way down for people. It all kind of depends. And then think about what the demand of the movement is. If you're doing 1 rep max at the gym, you may actually need to hold your breath to get enough stability of that spine. But if you're doing just picking up the laundry basket or even doing lighter weights, more repetitions, you shouldn't have to hold your breath when you're doing some of those exercises. So again, pause, see if you can put both of those two together. Okay, and then we have, I was right, sorry. We have the abdominal muscles. So we've got 4 layers here. We've got the external obliques. We've got our internal obliques, rectus abdominis, or our sit-up crunch 6-pack muscles. We have this linea alba that goes in between. And if you have heard of diastasis recti is a thinning of this layer that a lot of times it happens in most of us with pregnancy. And then sometimes it spontaneously just kind of goes back to what it was. Sometimes it can stick around. And then when people do like a sit-up motion or pull-ups or planks or something, squats even, some people will see a bulging in this abdomen, in this midline. And that can mean that we're not activating that transverse abdominis. That transverse abdominis is going to give that tension there, help us manage our pressures within that system. And training this deep core and just core in general can actually help with continence. And I've had patients where they've been doing pelvic floor and the pelvic floor contractions are going well. And the big turnaround factor was just getting better core strength. There is a purpose for all core muscles. We need all of them to work, but by isolating this TA, we can make sure that we're activating that deep muscle prior to some of these superficial muscles. So we're going to talk through this TA contraction. And again, this video didn't sound very good. So what I'm talking about now is you're just trying to feel this like a taut string underneath versus something like bulging out into your fingers. So you can see that I have this like dome area versus there I'm activating my TA, and then I sit up and it doesn't bulge as much through there. I don't have a diastasis, so this is just my rectus abdominis firing more so than using my whole abdomen. So I inhaled there to get a good start. Exhale, bring belly button in. And I didn't do a great job with that, but I lifted my head. You can see it's kind of flat through there. So it's kind of like well distributed versus if I don't do the TA, you'll see like more of that bulging. And I was a little bit shakier actually when I did that. So I am going to then just go into like lifting my knee and kicking out. This one, you really should be able to just use your TA. So you shouldn't be using much of these more superficial muscles. So I'm inhaling, pelvic floor contraction, because remember that that connects to those lower TAs. I lift up, no pelvic rocking. So before I keep going, you shouldn't shift side to side. So if I'm lifting my left leg right now, my right side pelvis shouldn't come up. So it should stay pretty stable within this. The other thing that shouldn't happen is any bulging into my fingertips that are just on the inside of my pelvic bones. It is going to feel like you're not doing anything, which is better than if you really feel like you're using those muscles like I just did. So you can see there's not a ton of movement there. So I want everyone to practice. You're going to find those pelvic bones in the front, go in about an inch. And then when you do this, you really want to try to feel that it's just kind of getting taut underneath your fingers versus bulging out into your hands. This can be really difficult to get and really frustrating to get. I had a really hard time when I first started learning this because I just wanted to go straight to my rectus abdominis, and it doesn't feel like you're doing much when you're just activating it. So the thing that helped me the most was think almost a pelvic floor contraction before. And then you don't really want to move much of your rib cage at all. Like everything in this upper body should stay pretty still when you're trying to find this TA. This one can be really helpful to find someone who knows, excuse me, like how to get the TA activated, because it can be really hard to figure out if you're doing it on your own. So feel free to watch that video again if you need. I know it's kind of hard to see, but yeah, give that a go. Okay, let's keep going. Okay, so now what? So we've got the basics. We're on the table for each of those, or practicing just isolating, and that's good and dandy, but a lot of times that's not enough. So a lot of times we have to move into more functional exercises. So we're gonna go through squats, lunges, and jumping, because how many times a day are you sitting and standing and picking something off the floor, getting down on the floor with your kiddo, and then getting back up, running after your dog or your children or whoever, whatever it may be. So let's start going over a few of these. So we're gonna start with a squat. You can see the difference in these two pictures that Lauren's back is more arched through here. So she is more flared through those rib cage, which means she's not getting as much core activation and probably not as much glute activation as she could. So with Lauren, she was having a hard time like getting down deeper in the squat. Truly, we've been working on this. And by her activating a little bit of that core without tucking her butt under, so she's not like tucking that tailbone under, she's able to get lower and lower into her squat. So again, doesn't sound great, so I'm just going to kind of repeat what she's saying. So you're going to think rib cage stacked over pelvis. And then you want to think about doing a hip hinge first and sitting down. So her knees don't come too far over her toes. And her spine is staying in a neutral kind of alignment. And knees stay lined up with second toes. So there she's arching a bit more, so she's losing that rib cage stacked over pelvis. There she's a little bit more, so she can use that core more. And then here she's talking about don't let your knees fall in, keep that knee over that second toe, and you'll get more in your glutes there. So everyone go ahead and stop. There's a lot of things to think about with everything. You've got rib cage stacked over pelvis. Think about hinging from your hips first and keeping the knees over your toes. And then when you stand up from the squat, think squeezing your butt. And then if you want to add the breathing and the pelvic floor, think inhale on the way down, exhale on the way up. There's a lot to focus on, and I don't expect you to focus on all of that at once. Pick one or two things to start thinking about and then go from there. So maybe your first 4 reps, you focus on just starting the hinge from the hips. The second 3 or 4 reps, you focus on what your knees are doing. And the last ones, you focus really on your breath and exhaling as you stand up. Okay, moving on to lunges. You can see with these pictures on the left with both me and Lauren that our pelvis is dropped side to side, our knee is way over. And then in the second video, our knees are more over our second toes and our pelvis is more in alignment. So you can see knee is more over second toe. Mine was pretty okay, but I was really dropping through that hip, which means I probably wasn't using my as much as I could. Whoops. So same thing with the squat. You're going to think that rib cage stacked over pelvis and then think about activating those glutes. So watching Lauren doing this. So she's starting with just her pelvis alignment and then thinking about the rib cage stacked over pelvis. And then when she steps forward, she's dropping straight down. Pelvis stays level, relatively level. Rib cage stacked over pelvis. And then things we don't want to see is that flaring, because we don't really want to see, it means we're probably not using our core as well. And then if we go from the front, so again, that side, which means we're probably not getting the glute activation or that knee goes in. So same thing with the squat. Think that knee goes over the second toe. Exhale on that way up. You can start with doing more of a reverse lunge or where you're starting standing and then one leg goes behind you into a lunge and then really squeeze your glute as you stand back up. Again, lunges can be pretty complicated. So again, pick a few things to think about, 1 or 2 things to think about as you practice them, and eventually it'll all start to become more natural. So everyone go ahead and stop and do a few reps or sets of these to start practicing some of these things. But moving on to more jumping jacks. So this is jumping jacks, jump rope, any jumping, really any running. You can see here my head is super far forward. And on with our whole body, a change that happens at the foot or the head can affect the rest of the body. So I probably wasn't using my core as well as I could. It's not great for the back of my neck here. Here you can see that my head's in better alignment. You can see my rib cage is stacked over that pelvis. Here with Lauren, you can see that she's arched. A lot of women, when they jump, and it could just be they're not getting as much force down here from their legs, or they're a little bit weaker, so they really try to get in the air using like leading with their chest. I want you to think about keeping, again, that rib cage stacked over the pelvis, so you're more in alignment. That gaze is like straight in front of you or slightly down, and you're slightly hinged forward at your hips. This is just going to, again, help maintain better alignment through here. So if you are having problems with leaking when you're jumping, sometimes even just getting a better alignment through here can be helpful. Yeah, so let's watch the video, and then I'll give a couple other. So she's talking about that rib cage over pelvis. And then she's talking about just keeping that head forward and down. And there she's kind of leading more with her chest, which makes her back arch a little bit more. And then you're not engaging those core. And it can put more pressure on that pelvic floor. So she keeps stacked, some engagement. She's not, yep. And then she made a really good point here to make sure when you land that the knees don't cave in too. And then just watching that gaze too. Now, if you try those things with the rib cage stacked over pelvis, slight hinge forward, and it's still not working, really check in to see how hard you're landing. So it could be that you're like landing like pretty hard on the ground, which just increases the force that's being transmitted up, which just can make it harder for that pelvic floor to react. So the softer you land, typically the easier it is on your pelvic floor. The other thing you can try is with like each jump, you can try a quick exhale. So every time you jump, and sometimes that can help as well. It also just keeps you from like always activating it. And then every, few reps or seconds, depending on what you're doing, you can think about taking 2 or 3 diaphragmatic breaths through your nose and out through your mouth as best as you can. You're going to get a little bit more like shoulder engagement with that, just because your breathing is going to be harder, and that's okay. But then that can give your pelvic floor like a chance to reset too. So it can be super awkward. It doesn't fix everything, but just a few things that can help. One of the biggest mistakes I hear people say that they do is really try to hold that pelvic floor on the whole time that they're jumping or running. And just like if you were to hold your quads on the entire time you're running, like they would fatigue out and it just wouldn't be very good. So think again, the pelvic floor should have this natural reaction to impact. So you don't want to just like hold it the whole time, because it will fatigue. Even the strongest pelvic floor will fatigue if you're trying to hold it at that max contraction. So with any of these, it can be really difficult to like see what you're doing. So like Lauren and I have, analyzed each other's squats and everything, just because it can be really hard to tell what you're doing without someone telling you what you're doing wrong. So reach out to pelvic floor PT, your PT that you know, a trainer, and have them, if you're having problems with like a squat or something, have them look at it and see if they can give you some tips. These are just some quick tips. So if you're ever like, oh my gosh, I don't even know where to start, breathing is a great place to start. So exhale, not exertion. If you always leak when you bend to pick something out of the oven, think I'm going to inhale before I bend down and exhale on my way down. Or that works with anything that you normally leak on. This can take daily practice. So it can take, like, if you can do 10 to 20 breaths a day, when you can be uninterrupted, which I know can be crazy, especially if you're at home trying to work from home, kids are at home, the whole deal. But if you can just stop and try to practice a few of those breaths, a little bit can go a long ways. Ribs stacked over pelvis. It's a great place to start. Not always the answer. So some people will ask, like, well, what about yoga when you're doing like the dancer pose where you're meant to stretch out? That's okay, because some of them were trying to get a little bit more back movement, and it's literally impossible to get more motion while keeping that. So it's not always the answer, but it's a good place to start. And then we talked about that landing softly. So landing hard transmits more force through the body, potentially stressing the pelvic floor and those joints more. And then you want to think just getting strong. So that can be in any different way. But focus on getting that form down first before trying to do exercises too quickly. So slow down if you have to. Don't feel like you have to keep up the pace with everyone else. Having strong glutes, butt muscles, core, and adductors, which are your inner thigh muscles, can help with continence and make your movements more efficient. So just getting everything else strong can be helpful too. Modifications, there are a ton of modifications that you can do. So if you've practiced all these things and box jumps just still aren't going well, we can give you some ideas for modifications or for even different ways to like break down the box jump and work on specific parts before doing it again. So if you have questions on modifications, please reach out. We got a bunch of different ideas. So if you do want to reach out, our email addresses are listed above with a phone number for Kepros Physical Therapy. And then there's our address if anyone is interested. We are doing telehealth services for those that don't feel safe coming in or just are too busy at home trying to manage everything at this time. Or we are doing some in-person appointments too, and combinations. Some people will do a little bit of both. So if you do have questions and do want to get seen, please don't hesitate to reach out. But I hope this was helpful. I hope you got something out of it. I'm not a professional by any means with the video, so thank you for bearing with me. And yeah, I hope everyone has fun trying these things, and good luck.